Hi, everybody. Dr. Daniel. And today I'm talking about migraine and eye twitching. Migraine is a neurologic problem that is related through genes and your family. 12% of persons have migraine. 25% of women and 6% of men have migraine. The frequency of eye twitching is not reported, but it's rare in clinical neurologic practice. Eye twitching is the benign, bothersome medical symptom. Sometimes eye twitching will come with a migraine. However, migraine does not cause eye twitching. They both relate to stress, poor sleep, and insomnia. Related questions. What is migraine? Migraine is a primary headache disorder with recurrent, moderate to severe headaches, which may be one-sided, throbbing or pulsing, and associated with nausea, vomiting, or associated with sensitivity to light or sound. As a rule, an individual migraine lasts 4 to 72 hours, and they're worsened by activity, being up, and the person who has it wants to lie down and go to sleep. What is eye twitching? That is called blepharospasm. The lid itself is called blepharo, and to spasm means to twitch or to draw up. Blepharospasm. What causes a migraine attack? Well, a migraine attack can be set off by certain events called migraine triggers, and these are stress, freedom from stress, estrogen drop, which occurs the third week of the normal menstrual cycle for women, estrogen-based birth control pills or estrogen patches or estrogen intramuscular injections, sleeping too little, sleeping too much, barometric pressure change, dieting or missing meals, red wine and specific foods, too much caffeine, or stopping caffeine. What causes eye twitching? Lack of sleep, eye strain. You don't really know what that is. It's a lay term. It's commonly used, and so it's sort of a vague symptom. It means kind of your eyes are tired or something. A dry eye, too much caffeine, stress or anxiety, driving long distances, irritation from allergies, pollution or chemicals, or exposure to bright lights. Are there any medications that worsen eye twitching? Antihistamines, calcium channel blockers, dopamine agonists, noradrenaline, selective serotonin reuptake inhibitors, SSRIs, antipsychotics, or neuroleptics. The patient should not stop any medication without first talking to their doctor, though. What is meant by eye twitching? Twitching of the eye is an involuntary movement that can affect one or both eyes. It's usually a single or short run of twitches. It goes twitch, 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 like that, lasting seconds only. Sometimes it will dry the eye down closed, but it doesn't interfere with vision for very long. If so, it's brief. Eye twitching does not cause pain and is not a concerning neurologic symptom indicating something wrong with the brain. Eye twitching is an involuntary movement that can cause one or both eyelids to contract suddenly and briefly. It is thought to be caused by muscle spasms from the muscles around the eye. What's the duration of this eye twitching? Individual twitches last seconds and may vary from person to person and event to event. The twitches or spasms are usually intermittent over minutes to half an hour. Some persons develop twitching from close visual observation, such as reading or watching TV. Twitching may come on and off during the day. It may be there for intermittently during one day and then disappear for months. Why do migraine and eye twitching come together? Migraine and twitching of the eye can relate to stress, poor sleep, or too much caffeine. Persons who develop eye twitching present to the world a facial constitution of worry with chronic contraction of the muscles around the eye, the forehead, and the jaw. Just as a jogger can get cramps in their leg muscles related to running, a person who holds their facial muscles tightly a lot may later develop twitching. How to treat eye twitching? One could use a hot compress over the eye, rest the eyes, lie down, take a nap, exercise, change your life plans and de-stress, You could try very gentle eyelid massage. Take a benzodiazepine tranquilizer if your doctor agrees and will give it to you. Now, there is another concerning chronic problem called benign essential blepharospasm, and that really doesn't relate to migraine. That's a chronic neurologic problem where the patient has what's called a dystonia, which means there's an unusual increased tone in the eye muscles which open and close the eye. This condition is chronic. The symptoms are present daily over the years. The symptoms are not intermittent, like with twitching eyes, as discussed here. This is a severe neurologic problem and may be treated by Botox injections given by a special neurologist, which releases muscle tone so the eye can open. And that condition can cause ptosis, P-T-O-S-I-S, which means the eyelid itself drops down, covering the pupil and preventing vision. So, I hope that all you folks do well. If you've had migraine and eye twitching, please not to worry about it. Read this article. Please click like and subscribe down there, and I will see you again on the next talk.